Thank you, Presiding Officer. To ask the First Minister what action the Scottish Government is taking to improve access to sexual health advice.
First Minister.
Access to sexual health advice and services continues to be one of the Scottish Government's priorities, which is why we're currently revising the Sexual Health and Bloodborne Virus Framework. Sexual health is also a key priority in our Women's Health Plan, which looks to improve access to contraception services. The development of the NHS Inform Women's Health Platform provides easy access to information, including contraception and sexual health. We also have ambitious targets to eliminate hepatitis C as a public health threat by March 2025 and eliminate HIV transmission by 2030. The framework will set out priorities for sexual health in BBV and will also be making an announcement on its publication very shortly indeed.
Clare Adamson.
First Minister for his answer. According to Public Health Scotland, cases of gonorrhoea were steadily increasing prior to COVID pandemic, but have increased rapidly since the end of 2021. They are now almost 50% higher than those recorded in 2019. Does the First Minister agree that these figures speak to the need to both redouble our efforts, firstly, to encourage people of all ages and at all stages of life to practice safe sex, and secondly, to end the stigma around seeking medical assistance in the cases of STIs?
First Minister.
Yes, I do agree with Clare Adamson wholeheartedly, and I think that point of emphasis that Clare Adamson makes on those of all ages, I think, is really important, because although we have a lot of outreach work, awareness-raising campaigns that are targeted towards young people, when it comes to STIs, of course, they can affect people of all ages. And we know following the pandemic, specialist sexual health services have been working hard to try to reduce that backlog in contraception provision and recovering to pre-COVID levels of services. There are simple and painless tests for gonorrhea. It can be cured and harm limited if appropriate antibiotics are given at an early stage. To add to the point I was making earlier on, or just a moment ago, Deputy Chief Medical Officer Professor Nicholas Steedman has written to NHS boards to highlight the importance of early diagnosis of gonorrhoea. So the Government will do everything we can to raise awareness of this important issue, but make sure it is a campaign that is not just targeted towards one specific demographic, but given that people of all ages can be affected by STIs, by gonorrhoea, we'll ensure that we take a broad brush approach in that respect.